Hi everybody, this is Spinal Flossing and I'm Brian McMaster. Let's start out with our spinal flossing exercises. Reach up as high as you can, side bend one time either way, rotate one time either way. Reach up high and lean back, come forward and squat. Good. Step to the side, turn your foot in, rotate your body in the opposite direction of your foot point. Step back, step, turn your foot out, rotate your body in the opposite direction of your foot point. Nice and easy. Okay, one time either way. So today I want to talk about the importance of just this part of the spinal flossing exercise and how it can help maintain the health of the hip flexors. Hip flexors are deep muscles that attach on the inside of the hip, come through the pelvis, attach to the inside of the pelvic rim, and then up through the pelvis and to the lower 5 vertebrae in the lumbar spine, or the lower part of the spine. I'm going to quickly show you a picture of this on this diagram so you have a bit of a visual. And then, okay, so here we are inside of the hip, coming up the psoas portion, the psoas portion coming up from the hip to the lower 5 vertebrae, and then the iliacus portion coming into the inside part of the pelvis. So you have an idea. These need to be equally strong and equally flexible, or they create torque in the spine on one side, create pinching of the facet joints at the back, torque on the discs slowly over time, and they can put more pull on one hip than the other. Very important that they're equally strong and healthy. So getting circulation to them on a consistent basis is really, really important. And then building the coordination back into this, the awareness back into this, it needs to be done brief and frequent, like 10, 20 times a day, and it doesn't have to be aggressive, it just needs to be light. So when your foot turns in, you're rotating outward with your upper body, you're getting your outer thigh, butt, and back. That's an important connection as well, but hip flexor is inner thigh, hip flexor, and lower abs are being stretched here. It's a great, easy stretch to do. Nice and smooth, one time either way. Let the nervous system know that they should be stretched equally both sides. You want circulation through that full area. And it's not very aggressive. You know, as you do it more consistently, you can get through a greater range of motion, and that's going to take some significant stress off the lower back, especially if you're side dominant, you're pushing off with more, you're one of those sprint athletes that you're leaning forward all the time, using your hips a lot of times. That creates fatigue, especially on one side more than the other. Creates torque and compression, and creates what's called a facet syndrome. And that, you know, we can adjust and help you with that, but ultimately you need balance in those hip flexors and ability for them to grow a little bit longer, so you can stand up a little bit higher and or straighter, and then let that pelvis untilt. Okay, so lots of benefit for doing your spinal flossing exercises, especially maintaining the balance in the hip flexors both sides. I'm Brian McMaster. This is Spinal Flossing. I'll see you guys tomorrow.